Hello my dear students, welcome to the MS Science Academy. Myself Meenu Srivastav, and today we are going to discuss about the hormonal regulation of the blood glucose level. Okay, I want to tell you something that according to the B.Pharma biochemistry syllabus, I have uploaded the unit 1, unit 4, unit 5 and unit 2, unit 1, 4 and 5 is already uploaded, but unit 2 is running, and after that unit 3 is only remaining. Okay, so you don't worry about your syllabus, we will complete it very soon. So now we will discuss, now without wasting time, we will discuss about the hormonal regulation of blood glucose level. Here the hormonal regulation of blood glucose level, first of all we are going to discuss about the hormonal regulation. I want to discuss about the what is the value of the blood glucose level for the fasting, for the post glucose load and the random. In the fasting means if you have taken the food before 12 hours, after the 12 hours, if you have taken the food and after the 12 hours, 12 or 14 hours you are taking the glucose level, so that glucose level is known as the fasting. Okay, so here the fasting level is the 70 to 100 mg per deciliter. And the post glucose load, what is the post glucose load? And the glucose load which is present after the eating food or taking the food, and that is known as the 110 to 140 mg per deciliter. If there is no glucose and there is no fasting or post glucose load, if we want to take the random, that random value should be the 70 to 140 mg per deciliter. Suppose that the value of the glucose is around 180 mg per deciliter or above the 180 deciliter and 180 mg deciliter. So that condition, the glucose appear in the urine, and that particular condition is known as the glycosuria, because the glucose appearance in the urine is 180 mg per deciliter or above that particular concentration. Because at that particular concentration, kidney will allow the glucose from the urine, so that the extra glucose level will balanced. Okay, so urine will allow the extra glucose level, and so kidney wants that the glucose level anyhow optimize. Okay, so in that condition the urine will the glucose appear in the urine. That condition is known as the glycosuria. Here I want to discuss about the how the blood glucose level means the sources which increase the blood glucose level. First of all, this is a dietary source. Whatever food we are taking, either it's a carbohydrate, either it's a protein, either it's a lipid, they are all belonging to the they increase the blood glucose level, either whatever food we are taking. So the blood glucose level sources, first source is the dietary source. Second is the glycogenolysis. Glycogenolysis means the conversion of the glycogen into glucose. So automatically, if the glycogen convert into the glucose, it will increase our blood glucose level. Now the third, that is the gluconeogenesis. The gluconeogenesis means the conversion of carbohydrate, the formation of carbohydrate from the non-carbohydrate. So that gluconeogenesis increase our blood glucose level. So these are the such process will increase our blood glucose level, but there are some process also in which the blood glucose that glucose is utilized. First, this process, that glycolysis. In that glycolysis, the glucose is utilized or converted into the pyruvic acid. HM patient is the alternative pathway for the glucose metabolism, which we have studied. Glycogenesis means the formation of glycogen, means if the glycogen is formed, so the glucose is automatically converted into the glycogen, so the blood glucose level automatically comes down. Here the lipogenesis means the formation of lipid. That process, when the lipid formation takes place, that utilize the energy, and for the lipogenesis the glucose is metabolized. Okay, so for that process automatically the glucose level comes down. So what is the low glucose level? What terms which we are using for the low glucose level, for the high glucose level? So if the glucose level, blood glucose level is low, that name is a hypoglycemia. Blood glucose level low, that name is a hypoglycemia, and the blood glucose level is high, that named as the hyperglycemia. The hypoglycemia or the hypoglycemic hormone is the insulin. In our blood, only the insulin is responsible for the hypoglycemia, means only the insulin is responsible for lowering our blood glucose level. But in the hyperglycemic condition, there are so many hormones which are responsible for this hyperglycemic condition. First, that is the glucagon. Second, thyroxine. Third, cortisol. Fourth, Adrenocorticotropic Hormone ACTH. Fifth, growth hormone. Sixth, that is the epinephrine. Okay, sixth, that is the epinephrine. Now, here the insulin is only the hypoglycemic, but there are so many hormones which produce hyperglycemic condition. Okay, insulin is secreted by the beta cells of pancreas, whereas the main hyperglycemic hormone, which is the contradictory for the insulin, it's releases by the alpha cells of the pancreas. Okay, so that you have to keep in your mind that the insulin is secreted by the beta cells, whereas the glucagon is secreted by the alpha cells. They are both present in the islets of the Langerhans present in the pancreas. Okay, so the main condition, so the hypoglycemic condition only developed with the insulin, whereas the hyperglycemic conditions are developed through the many of the hormones. What insulin is doing, just see the process. This is the blood and this is the cell. What insulin will do, insulin will take the glucose from the blood and just take into the cell. Means insulin has the gate pass. Insulin has the gate pass for the glucose level. It takes the glucose level with its hand and just easily push into the cell. Getting my point? That insulin is having the rights or the copyright to push out the glucose into the cell. Okay, so glucose level, blood, so the glucose is taken with the insulin and easily enter into the cell via insulin receptors. Okay, here the cell is whereas the glucagon, it's a glucagon just take the insulin and increase the glucose level in the blood. So this is the main two anti-hormones. Insulin is just increase the glucose level into the cell and lower the glucose level in the blood, whereas the glucose level is increased by the glucagon and decrease the glucose level into the cell. I think you are getting my point. If you have any doubt, kindly ask me in the comment section. Okay. Now, the insulin is increasing so many processes so that the glucose can be utilized. In the first process, that is the glycolysis increase. So, the insulin increase the glycolysis. This sign is for increase. Okay. So, insulin increase the glycolysis. Insulin increase the glucose uptake via the insulin receptor. Third, it decrease. This is the decrease. Insulin decrease the glycogenolysis, means the glycogen-lytic process, means the conversion of glycogen into the glucose. That process is decreased. Gluconeogenesis process is decreased. Gluconeogenesis means the conversion of glucose, the formation of glucose from the non-carbohydrate. That process also decreased by the insulin. Lipid synthesis increased. Lipid synthesis, I have already told that glucose is utilized in the lipogenesis. So, the lipid synthesis is increased by the insulin. HMP shunt, I have already told that the glucose is utilized by the HMP shunt. So, that process is increased by the insulin. And the glycogenesis means the glycogen formation, its process is increased by the insulin. So, like the increase or decrease by so many pathways, insulin want to regulate our blood glucose level or want to just decrease our blood glucose level because it's a hypoglycemic hormone. Now, come under the category about the mechanism. Now come the mechanism, means how the insulin work on different enzymes. So these kind of the processes will suppress or will activate. Here the insulin first activate the hexokinase. Hexokinase activity, we will see that it convert the glucose into the glucose 6-phosphate in the glycolysis. This is the first step of the glycolysis, that the glucose is converted into the glucose 6-phosphate. So that enzyme will proceed the glycolysis and the insulin increase the glycolysis. So the hexokinase activity increase. Second, it increase the hepatic glycogenesis, means in the hepatic, means the liver, the glycogen process will increase. Here the hepatic glycogenolysis process is decreased and the gluconeogenesis process is decreased. Here the insulin increase the activity of pyruvate kinase. Pyruvate kinase is the enzyme which helps the pyruvate into convert into the oxaloacetic acid in the gluconeogenesis, which we have already studied. Okay, if you want to see the gluconeogenesis, you will type the MS Science Academy gluconeogenesis, you will get my lecture. Okay, so the pyruvate kinase activities will increase by the insulin, so that insulin will proceed, the pyruvate kinase, I think I am getting somewhat confused. Sorry. I will take my words. Okay, the pyruvate kinase, the pyruvate carboxylase. I'm very sorry. The pyruvate kinase is the enzyme which convert the phosphoenol pyruvate into the pyruvate in the glycolysis. Okay, so I'm very sorry. The pyruvate kinase is the enzyme which help to convert the phosphoenol pyruvate into the pyruvate. So that activity is performed by the pyruvate kinase. So the insulin will increase the activity of pyruvate kinase. By increasing the pyruvate kinase activity, the insulin will mediate or will facilitate the glycolysis formation, glycolysis process. Okay, now it decreases the pyruvate carboxylase. So that pyruvate kinase or pyruvate kinase or carbonase, I got confused, sorry. Decrease the activity of pyruvate carboxylase. What is the pyruvate carboxylase? This is the enzyme which utilized in the gluconeogenesis. Okay, in the gluconeogenesis, the pyruvate enzyme, pyruvic acid is converted into the oxaloacetic acid by the pyruvate carboxylase. So that activity is reduced, so the gluconeogenesis automatically will reduce. Okay, and the insulin, insulin will increase the permeability of cell membrane, promote the influx of glucose into the tissue or the cell via insulin dependent transporters, that is the GLUT4. Okay, there are so many insulin dependent transporters which can mediate or which can facilitate the glucose transport into the cell. Okay, so insulin will take the glucose from the blood, and with the help of insulin receptors and these insulin dependent transporters, that is the GLUT4 mainly, that insulin will easily just increase the permeability of cell for the glucose. Okay, by this it decrease the glucose level in the blood. Now the insulin, how it will act? It will act or it will help by the cyclic AMP. The insulin increase the utilization of cyclic AMP. Now the one question in your mind, one question comes in your mind, and how the cyclic AMP works on that insulin enzyme, insulin mechanism. That insulin act on the cyclic AMP. Okay, so the cyclic AMP will convert into the 5-AMP or adenosine monophosphate. This 5-AMP will, that cyclic AMP is converted into the 5-AMP with the help of phosphodiesterase. This enzyme will activate by insulin, and when the cyclic AMP is utilized, So there is no more in the side, no more cyclic AMP. So that protein kinase enzyme remain inactive. Okay, because the protein kinase activity is needed the cyclic AMP, but the cyclic AMP convert into the 5' AMP. Okay, so the protein kinase which remains inactive due to the absence of the cyclic AMP, that inactive protein kinase will initiate the glycogen synthase. What the glycogen synthase works in the glycogenesis, I have discussed about the glycogen synthase, that the glycogen synthase act on the glucose and convert into the glycogen. Okay, so if the glucose is converted into the glycogen, so there is no more glucose remain in the blood, because all the blood convert into the all the glucose convert into the glycogen. So by this so many mechanisms, insulin work on the blood glucose level for decreasing the blood glucose level mainly. Now we will come to the hyperglycemic hormones like glucagon, growth hormones, cortisol, ACTH and so on. So come on the hyperglycemic hormones. Now come to the glucagon. Glucagon is a hyperglycemic hormone, and it act by deactivating or activating different kinds of enzyme. Like that, it decreases the activity of pyruvate kinase. Pyruvate kinase, I have already told that this enzyme utilized in the glycolysis to convert the phosphoenol pyruvate into the pyruvic acid. So that this enzyme activity will reduced by the glucagon. It increase the activity of pyruvate carboxylase, which help for the gluconeogenesis. Now the glucagon, it has such kind of different mechanism also. It just increase the activity of cyclic AMP by activating the adenylate cyclase enzyme, and this cyclic AMP convert the protein kinase into its active form. A represent for active form, and this protein kinase will convert the phosphorylase kinase into its active form. Okay, so means the protein kinase will convert inactive phosphorylase kinase enzyme into the active phosphorylase kinase. So this enzyme, with the help of calcium, this enzyme convert the just activate the glycogen phosphorylase. This glycogen phosphorylase help the convert the glycogen into the glucose. So by this activation, the glucose is increased in the blood, and the protein kinase active form just inactivate the glycogen synthase, and this inactivation leads the increase the activity of glucose, so that the inactive glycogen synthase can't able to convert the glucose into the glycogen, so automatically glucose level will increase. Here the other mechanism here, the growth hormone. The growth hormone is the somatotropin hormone, which is secreted by anterior pituitary. It decreases the glucose uptake, especially the muscle and the adipose tissue, and it stimulates the secretion of glucocorticoids. The glucocorticoids has the some examples of glucocorticoids. Glucocorticoids are released from the adrenal cortex. Okay, some examples like 11-dehydrocorticosterone, 11-dehydro-17-hydroxycorticosterone, and 17-hydrocorticosterone. They stimulate the gluconeogenesis in liver, and they inhibit the utilization of glucose in extrahepatic tissue. Here they increase the activity of some enzymes which are used for the reversal of glycolysis, means for the they initiate the gluconeogenesis. These enzymes like glucose 6-phosphatase and fructose 1,6 biphosphatase. Okay, so the glucocorticoids initiate these activate such kind of enzyme. The thyroxine hormone is secreted by thyroid gland, which accelerate the hepatic glycogenolysis and susceptibility and increase the susceptibility of organisms to the epinephrine. Now we will see the mechanism of epinephrine also. It will accelerate the destruction of insulin, means that it will this thyroxine hormone destruct the insulin, so the insulin will not take place in that particular site or cell. Here the adrenocorticotropic hormone increase the blood sugar level and stimulate the secretion of glucocorticoids. Okay, and the thyroxine. Okay, so the glucocorticoids released with the adrenal cortex and the thyroxine released with the thyroid gland. Now come to the epinephrine, and epinephrine part. One epinephrine is also the hyperglycemic hormone, and the one mechanism of the epinephrine is same as the glucagon. Now we will see the mechanism of the epinephrine, how it will work. Now we will discuss about the epinephrine. As we have already told that the epinephrine has the same mechanism as the glucagon. Epinephrine also a hyperglycemic hormone. Okay, so it increases the glucose level in the blood. How it works? It increases the cyclic AMP. By cyclic AMP, it deactivate the glycogen synthase, and by deactivation of the glycogen synthase is it increase the glucose level in the blood. As it increase the glycogen phosphorylase enzyme, which that particular enzyme initiate the glycogenolysis also. So epinephrine is the hyperglycemic hormone which increase the glucose level. It is secreted by adrenal medulla. Okay, it is secreted by adrenal medulla. Okay, so don't get confused. Here I have summarized that which hyperglycemic hormone perform which type of function. Like glucagon increase the gluconeogenesis and glycogenolysis. Epinephrine increase the glycogenolysis. Thyroxine increase the gluconeogenesis. Glucocorticoids increase the gluconeogenesis and decrease the glucose utilization. Here the growth hormone and the ACTH decrease the glucose uptake by the cell and decrease the glucose utilization also. So by this process, these hyperglycemic hormones perform their function and increase the blood glucose level. I hope you have enjoyed my lecture. Any doubt, kindly ask in the comment section. Otherwise, please like, share and subscribe. Thank you.